everyone. Welcome to Boost Your Dentistry IQ. I'm Dr. Pam Maragliano-Muniz, Chief Editor of DentistryIQ.com. Today, we're going to talk about one company's way that they are giving back to support dental practices that have patients that are undergoing cancer therapy. With me today is Quinn Miller. She is the sales manager at OraCare and the advocate of the OraCare-Cares program. She lives in the wild and wonderful hills of West Virginia with her husband, daughter, and wait for it, a pet mini donkey named Sturgill. How adorable is that? Quinn, thank you so much for joining me today.
Thank you so much for having me, Pam. I'm super excited to be here.
Oh, the pleasure is mine. Now, I know from my experience in my practice that I've been using OraCare for a while. Activated chlorine dioxide has many, many benefits, including periodontal disease. We actually use it for our scaling root planing patients, a pre-rinse before dental procedures. It has xylitol in it, so it helps with xerostomia, also helps with reduction of caries. So it's sort of a jack of all trades. But I'm hearing recently that there's a new demographic of patient that's benefiting from OraCare. Can you tell me a little bit more about that?
Yeah, absolutely. And I'm so excited to hear you're utilizing it, so heavily throughout the practice. We love hearing what it's able to help benefit. So a new use, and this is so exciting because it's something we never set out to do, is cancer care. And that's because OraCare's properties, the activated chlorine dioxide has been shown to help with bacteria, viruses, fungi. Fungi is a major, side effect of patients going through chemo and radiation. They're prone to frequent fungal infections, canker sores, the xerostomia that can arise from treatment. We started having, as dental offices were carrying the rinse, they were recommending it for all these uses, saw that if they had patients going through chemo or radiation, they said, hey, give this OraCare a whirl, see what you think. We saw it help tremendously with the oral side effects that chemo and radiation can bring on.
That's really interesting. And I guess I wouldn't always naturally think of OraCare when I have patients that are suffering from the side effects of chemo and radiation. Now, Dr. Bob Martino found this out and he decided to kind of do something about it and created the OraCare-Cares program. Can you describe the program and describe kind of how this all came about?
Absolutely. So as we started having the feedback roll in that it was helping patients, get through chemo and radiation, alleviate the oral side effects, Dr. Martino, he's a very generous man. He's wonderful. He came to me and said, what can we do with this? And I started looking at ways we could be a part of, organizations. And he said, let's help directly. He said, if one of our OraCare providers has a patient going through chemo or radiation, let's support that patient for free. Let's help that office get that rinse to that patient. So we developed a program, and the way it works is beautiful. It's so seamless. It's so easy. We launched it in November 2020. If an office has a patient going through chemo or radiation, they can simply submit that patient on a form via our website, put in that patient's shipping information, a little note of encouragement from the practice, hey, it's your team at, Wilmar Dental. We're thinking of you. Hope this rinse helps. We'll handwrite a little note. Our team, we have a girl here who fulfills those kits. We ship that directly to that patient's house, and that is free to the office and free to the patient.
That is so sweet. So you have to be an OraCare-Cares provider or an OraCare provider in your practice to benefit from this. Now, say the patient kind of blows through their mouth rinse, can they get it again? Or at that point, do they kind of get it through their dental office?
Right now the program is so new. It's anytime a patient is submitted through the program. And I did ask Dr. Martino, I said, is there, I'm going through all the checks I need to before we launch. I said, is there a limit? Is it one patient per office? And he said, no. He said, let's roll this out there. So there are no limitations. Right now, if you have a patient, it's point blank simple as that. If you have a patient who is currently undergoing treatment, submit them through this program, and we will help you support that patient.
I think that's so nice. And I think the patient would love to know that the dental office is thinking of them. I mean, from a marketing, patient care, warm, fuzzy standpoint, it really doesn't get any better than that. So you
Right.
said that this rolled out in November. What kind of feedback are you getting?
It's been tremendous. It's been amazing. And we're in I'm a sales manager here. We are in very close contact with our offices. Reach out to them daily, see how they're doing. The feedback has been amazing. I've had dentists personally say, "Hey, please thank your CEO for this. This is wonderful. We can tell you guys are really, thinking beyond outside the box, if you will, for ways that we can support patients." We've already sent out a couple hundred kits to every one of the 50 states thus far. We did have a big rollout on World Cancer Day just a couple weeks ago. We're going to do more with it in April during Oral Cancer Awareness Month. And I can't wait to see where the program goes. We're already getting in contact with some cancer facilities across the country to see, how we can help directly in some facilities beyond the dental practice. But right now, it's just phenomenal to have a way to let dentists and hygienists, the whole dental team, let that patient know, hey, we're rooting for you. We're thinking of you. We know this can help. Here you go.
I think that's fantastic. So where can people get more information about OraCare Cares? And if they're not a provider and they'd like to partake in this, how do they get all of this information? How do they get going?
Absolutely. If it's an existing OraCare provider, it's very easy. Go to our website, oracareproducts.com/OraCareCares. There you'll find the form. Within 30 seconds, you can submit that patient. We'll take care of that kit. You'll get a notification once the kit ships to your patient. If you're not yet an OraCare provider, signing up is easy. It takes a couple of minutes. And again, as you mentioned, there's so many uses for OraCare throughout the practice. Cancer care happens to be one of those wonderful uses, but many ways you can utilize the rinse to help patients in other ways as well.
Well, thank you so much for sharing this information, and thank you for what you're doing. I mean, my gosh, I feel like sometimes it just actually happened to be yesterday. I have a patient that came in to get kind of cleared dentally for her chemo radiation that starts next week. And sometimes you feel like you're on an island by yourself. And I obviously wished her well and told her I'm rooting for her. And I have a whole email that gives her information about how to keep her mouth healthy and her teeth strong. But to have something that's so easy, so supportive, and just such a sweet surprise that's not only just heartwarming, but really functional and beneficial to a patient is extremely wonderful at a time like this. So Quinn, thank you so much for sharing this information. And I hope dentists are able to learn a little bit more about it and participate if they feel that it's right for their practice.
Absolutely. Thank you so much for having me. I really enjoyed it. And if anybody wants to know, oracareproducts.com/OraCareCares.
Awesome. Well, give Sturgill a big hug for me, and I will see you soon.
Thanks so much. See you, Pam.
Bye.